Are you taking your blood pressure medication at the most dangerous time? Imagine this. Two people have the same blood pressure. They take the same medication at the same dose, yet one person's blood pressure stays under control while the other still struggles with dangerously high readings. Why? The surprising answer might have nothing to do with the medicine itself. It could be the time they take it. For years, millions of people have been told to take their blood pressure medication once a day, morning, night, whenever they remember. But recent research suggests that timing may matter for some people, depending on the medication they're taking and their individual health needs. In today's video, we'll separate myths from facts, explain what current science actually says, and reveal some common mistakes that could make your medication less effective. Because one small change, made only if it's appropriate for you and your healthcare provider recommends it, could make a real difference. Let's begin. Why blood pressure is called the silent killer. High blood pressure affects more than 1 billion people worldwide. The dangerous part? Most people don't feel sick. No warning signs, no pain, no obvious symptoms. That's why it's often called the silent killer. Over time, uncontrolled blood pressure forces your heart to work harder. Your arteries become damaged, and your risk of heart attack, stroke, kidney disease, and other serious health problems increases. That's exactly why doctors prescribe blood pressure medications, to help reduce those risks by keeping blood pressure within a healthier range. But medication is only one part of the picture. Sleep, diet, exercise, stress, and sometimes even when you take your medication, can influence blood pressure patterns throughout the day. However, it's important to remember that there is no single best time that works for everyone. The right schedule depends on your medication, your daily routine, and your doctor's advice. Your body has its own daily clock. Here's something many people don't realize. Your body doesn't operate the same way all day long. It follows a natural 24-hour rhythm, often called the circadian rhythm. This internal clock affects much more than sleep. It influences your hormones, heart rate, body temperature, and yes, even your blood pressure. For many people, blood pressure naturally rises in the early morning as the body prepares to wake up. Later in the day, it may gradually change depending on activity, meals, stress, and sleep. Doctors sometimes look at these daily patterns when deciding how to manage blood pressure. Some people also experience what's known as a morning surge, where blood pressure rises more sharply after waking. For certain patients, this pattern may influence treatment decisions. This is one reason researchers have explored whether medication timing could make a difference for some individuals. So, should everyone take their pills at night? At this point, you might be thinking, so should everyone switch to taking blood pressure medication at night? The answer is not necessarily. Over the years, some studies suggested that taking certain blood pressure medications at bedtime might benefit some patients. However, later research has shown the picture is more complicated, and experts do not recommend that everyone automatically change the time they take their medication. Different medications work in different ways. Some are designed to last 24 hours, others may be taken more than once a day, and some people have medical conditions where changing the timing could even increase risks, such as dizziness or falls. That's why the most important rule is simple. Never change the timing of your medication without discussing it with your healthcare provider. The number one timing mistake millions make. Now that we know timing can matter for some people, let's talk about the biggest mistake many patients make. It's not taking medication in the morning. It's not taking it at night. It's taking it at different times every day. Many blood pressure medications are designed to work over a full day. If you keep changing the time you take them, the amount of medicine in your body may fluctuate more than intended. For many medications, taking them at approximately the same time each day helps maintain a more consistent effect. If your schedule changes often, setting a daily reminder on your phone or using a pill organizer can make it easier to stay consistent. Can you take your medicine with? For millions of people, the day doesn't start without coffee, so naturally many people wonder, can you swallow your blood pressure pill with your morning coffee? The answer depends on the specific medication. Coffee can temporarily raise blood pressure in some people, especially if they're sensitive to caffeine or don't consume it regularly. In addition, caffeine may affect how some medications feel or work in certain individuals. That doesn't necessarily mean you must avoid coffee altogether, but if you're starting a new blood pressure medication or your readings remain higher than expected, it's worth asking your healthcare provider whether caffeine could be playing a role. For most medications, plain water remains the safest choice unless your healthcare provider or pharmacist advises otherwise. Before or after meals? Another common question is whether blood pressure medication should be taken with food. The answer isn't the same for every medicine. Some medications can be taken with or without food. Others are better tolerated with a meal because it may reduce stomach upset. A few medications have more specific instructions. That's why it's important to read the label that comes with your prescription and follow the directions provided by your healthcare provider or pharmacist. If you're unsure, don't guess. A quick call to your pharmacist can help you avoid taking your medication incorrectly. What if you miss a dose? It happens. Life gets busy. You look at the clock and suddenly realize you forgot to take your medication. So what should you do? The answer depends on how much time has passed and on the medication itself. In general, many medications come with instructions about missed doses. Often, if it's close to the time for your next scheduled dose, you're advised to skip the missed one rather than doubling up. But this is not true for every medication. Taking 2 doses together without guidance can increase the risk of side effects. If you're ever unsure, check the patient information leaflet or contact your pharmacist or healthcare provider for advice. Morning or night? What does the science really say? By now, you're probably asking the question everyone wants answered. So, should I take my blood pressure medication in the morning or at night? The honest answer is, it depends. For years, researchers have studied whether taking certain blood pressure medications at bedtime could reduce the risk of heart attacks, strokes, and other cardiovascular problems. Some early studies suggested that nighttime dosing might offer additional benefits for certain patients. These findings received a lot of attention and led many people to believe that taking medication at night was automatically better. But science doesn't stop after one study. As more research became available, experts found that the answer wasn't so simple. More recent evidence has shown that, for many people, the most important factor is taking the medication consistently as prescribed, not necessarily whether it's morning or evening. Today, many healthcare providers choose the timing based on the specific medication, the person's blood pressure pattern, possible side effects, daily routine, and overall health. That's why there is no universal best time that applies to everyone. Who might need a different schedule? Even though there isn't one perfect schedule for everyone, some people may be advised to take their medication at a specific time. For example, someone whose blood pressure is consistently higher in the morning, someone who experiences medication-related dizziness during the day, or someone taking more than one blood pressure medicine with different dosing schedules. In these situations, a healthcare provider may recommend adjusting the timing to match that person's needs better. That's another reason why it's important not to copy someone else's medication routine, even if it worked well for them. The best schedule is the one that's tailored to your health, your medication, and your doctor's recommendations. 5 daily habits that can work against your medication. Here's something many people don't realize. Even if you never miss a dose, some everyday habits may make it harder to keep your blood pressure under control. Let's look at 5 common examples. Habit number 1. Eating too much salt. Many processed foods contain far more sodium than people expect. Over time, excess sodium can make blood pressure more difficult to manage. Habit number 2. Not getting enough physical activity. Regular movement helps support heart health and can contribute to healthier blood pressure over time. Even a daily walk can make a difference. Habit number 3. Poor sleep. Not sleeping enough or having conditions like sleep apnea can affect blood pressure and overall cardiovascular health. Habit number 4. Chronic stress. Stress hormones can temporarily raise blood pressure, and ongoing stress may make healthy habits harder to maintain. Finding healthy ways to manage stress is an important part of overall care. Habit number 5. Skipping follow-up appointments. Blood pressure can change over time. Regular checkups help ensure your treatment plan is still appropriate and effective. The power of a daily routine. One of the easiest ways to remember your medication is to connect it with something you already do every day. For example, brushing your teeth, preparing breakfast, or getting ready for bed. Creating a consistent routine can help reduce missed doses without adding extra stress to your day. Some people also find it helpful to use smartphone reminders or weekly pill organizers. The goal isn't perfection, it's consistency. How do you know if your medication is working? Here's an important question. How can you tell if your blood pressure medication is actually doing its job? The truth is, you usually can't tell by how you feel. Many people expect high blood pressure to cause headaches, dizziness, or other obvious symptoms. But in most cases, high blood pressure causes no noticeable symptoms at all. That's why you could feel perfectly fine while your blood pressure is still too high. The only reliable way to know if your treatment is working is to measure your blood pressure regularly, using a validated home monitor if your healthcare provider recommends it, and by attending your scheduled checkups. Those numbers tell the real story. How to check your blood pressure the right way. Even the best blood pressure monitor won't give useful information if it's used incorrectly. Before checking your blood pressure, sit quietly for about 5 minutes. Keep your feet flat on the floor. Rest your arm on a table so the cuff is at about heart level. Avoid talking during the measurement. If possible, avoid smoking, exercising, or drinking caffeine for at least 30 minutes beforehand, unless your healthcare provider gives different instructions. And don't rely on just one reading. Many healthcare providers recommend taking 2 readings, about 1 minute apart, and recording the results to help identify patterns over time. 3 myths about blood pressure medication. Let's clear up 3 myths that still confuse millions of people. Myth number 1. I feel fine, so I don't need my medication anymore. Feeling well doesn't necessarily mean your blood pressure is under control without treatment. In many cases, people feel well because their medication is working. Never stop taking prescribed medication without speaking to your healthcare provider. Myth number 2. Natural supplements can always replace prescription medication. Some supplements may affect blood pressure or interact with medications. Still, they are not a substitute for prescribed treatment unless your healthcare provider specifically advises it. Always discuss supplements with your doctor or pharmacist. Myth number 3. If my blood pressure is normal today, I can skip tomorrow's dose. Blood pressure changes throughout the day. One normal reading doesn't mean your condition has gone away. Taking medication consistently as prescribed is usually the best approach unless your healthcare provider changes your treatment plan. The daily checklist. Before we finish, here's a simple checklist to help you stay on track. Take your medication at the time recommended by your healthcare provider. Try to take it consistently each day. Monitor your blood pressure if you've been advised to do so. Eat a heart-healthy diet and stay physically active as appropriate for your health. Keep your follow-up appointments. And if you ever have questions about side effects or timing, ask your healthcare provider or pharmacist instead of making changes on your own. Small daily habits can make a meaningful difference over time. Final thoughts. So, is there one dangerous time to take your blood pressure medication? For most people, the answer isn't about a single hour on the clock. It's about taking the right medication at the right time for you and taking it consistently. The best schedule depends on your individual health, the medication you're prescribed, and your healthcare provider's guidance. If you're thinking about changing the time you take your medication, don't make that decision on your own. A quick conversation with your doctor or pharmacist can help ensure you're making a safe and informed choice. If you found this video helpful, give it a thumbs up and subscribe for more evidence-based health tips designed to help you make informed decisions. And here's a question for you. Do you usually take your blood pressure medication in the morning, at night, or at another time of day? Share your experience in the comments below, but remember, everyone should follow the advice that's appropriate for their own health. Thanks for watching, and we'll see you in the next video.